Hi, welcome. One of the hardest symptoms to deal with in menopause, aside from anxiety, is pain. Sometimes debilitating pain that can strike anywhere. In this video, I'm going to list and talk about 12 areas of the body that are frequently affected by pain in menopause. Let's start with joint pain because it seems to be a very common complaint in midlife. There are estrogen receptors all over the body, including in the joints. When estrogen is low, there is very little protection against inflammation, causing the joints to swell. Also, estrogen regulates water in the body, so low estrogen equals less fluids and elasticity in the tissues of your joints. The result? Stiffness, soreness, and swelling in your knees, ankles, wrists, shoulders, and so on, which can definitely leave you feeling about 150 years old. Number 2 is pain in the lady bits. Atrophy is a very real issue for a large number of menopausal women, and it can be torturous. When estrogen drops, the tissues thin and dry out, and it can cause a list of very uncomfortable symptoms like burning, itching, soreness, pain, frequent UTIs, frequent urination, pain with intercourse, and even spotting. Moisturizers can help immensely, but some women react to the ingredients or see little improvement with those types of treatments. For those women, a microdose of estrogen cream in the area is safe and often effective. Number 3 is head pain. Headaches are often an issue during perimenopause when hormones are all over the place. They tend to flare when estrogen drops, usually around menstruation. Anxiety and stress, which also ramp up during menopause, can also contribute. Migraines are also a very real possibility and can cause debilitating symptoms like pulsing, throbbing, nausea, sensitivity to light, and even vomiting. Number 4 is abdominal and pelvic pain. This type of pain is very common in menopause, but it can have numerous possible causes. Things like stitches, cramping, aching, soreness, bloating, stabbing sensations, and so on can be caused by constipation, diarrhea, IBS, changes to digestion in general, PMS, pelvic floor dysfunction, fibroids, cysts, endometriosis. It can sometimes be very hard to pinpoint what's causing this type of pain, so it often requires investigation. Number 5 is breast pain. There are 2 types, cyclical and non-cyclical. Cyclical breast pain occurs during perimenopause when hormones are erratic and tends to cause sore, heavy, aching breasts. Non-cyclical pain usually occurs in postmenopause and tends to cause more of an aching, stabbing, and burning sensation. The causes for non-cyclical pain are much harder to pinpoint. It may stem from imbalances of fatty acids, sensitizing the tissue to hormone changes, conditions involving the chest wall, esophagus, neck, upper back, or stomach, or fibrocystic changes to breast tissue. Number 6 is leg pain. Painful twitching, cramping, burning, aching, stiff, and sore legs all occur during menopause and can be quite disturbing. Falling estrogen can affect magnesium absorption, the regulation of fluids in the body, circulation, anxiety, and stress, which can all contribute to some very uncomfortable leg-related symptoms. I suffer with leg pain, among other things, and it can make it almost impossible to rest and relax because the legs often act up further when they're at rest, contributing to insomnia, fatigue, and anxiety as well. Number 7 is tendon pain. New diagnoses of golfer's elbow, tennis elbow, wrist and Achilles tendonitis are common in menopause. Low estrogen increases the breakdown of collagen fibers, slows the production of new fibers, and causes less collagen and more elastin in the tendons. This causes more micro damage and a much longer length of time to recover, once again leaving many women feeling much older than they are and much achier than they should be. Number 8 is chest pain. This common menopausal complaint sends many women to the ER, fearing something heart-related is going on. Decreasing estrogen can increase anxiety, stress, panic attacks, costochondritis, heart palpitations, and stomach issues, which can all contribute to chest pain. although knowing that does not make this area of pain any less frightening. Number 9 is stomach pain. Tanking estrogen and increasing cortisol are known to slow digestion and cause several issues with the stomach and the digestive tract in general. Indigestion, acid reflux, and excess gas are common in midlife and often cause a great deal of pain and discomfort. Number 10 is neck and shoulder pain. Chronic neck tension and frozen shoulders are common occurrences in menopause. Low estrogen affects tissues, joints, inflammation, anxiety, stress, and tension that can affect the neck and shoulders, causing pain, stiffness, and a decrease in range of motion. This can take a significant amount of physical therapy to correct, especially in the case of a frozen shoulder. 11 is foot pain. Many women complain of foot pain during menopause. Sometimes it feels like I'm actually walking on marbles or Legos. It's horrible. Estrogen affects the elasticity of the band of tissue connecting the heel bone to the toes, as well as the thick padding of skin in the balls of the feet. So when estrogen drops, it can leave the feet in a very painful state. Number 12 is back pain, the lower back especially. Estrogen helps keep the discs, ligaments, and tendons healthy and flexible. So when it shifts in menopause, it will affect the discs in the spine, bone density, and inflammation, and cause pain, stiffness, and a loss of range of motion in the back. It seems we lose a lot more than just our periods in menopause. All of this pain can leave many women, myself included, in a great deal of discomfort and really affect quality of life. I didn't include suggestions in this video on how to help ease pain in these 12 areas, but I do have other videos specifically addressing some of these areas of pain if you're interested in learning more. I will include the links to those videos in the description. I wish you all health, happiness, and peace of body and mind. Thanks for watching. Subscribe for more videos on midlife and menopause, and I will see you all in the next video. Bye for now.